thank you all for coming out to learn about ALS. This is a disease that affects many people, and as clinicians, I think it's important that we advocate for the people we serve. And Tim Abeska will be facilitating this event, so I'll hand it off to him. And he is a champion of ALS advocacy, and I'm so excited and inspired for what he does for this patient population. And yeah, go ahead and take it.
Thank you, Carter. You've oversold me because I'm just one of many who are volunteer advocates with an organization called I AM ALS, which provides these panels to organizations such as your student association. I AM ALS is a patient-centric organization that is designed or intended to create awareness about what ALS is and what it does to the people who have it and their loved ones, provide support to patients and loved ones, and to drive forward the process of hopefully finding a cure for this disease through political persuasion and other efforts undertaken by some of the teams. My connection to ALS is that my wife passed away in January 2019 after living with the disease for 3 years and 5 months after diagnosis. We do have a PowerPoint that'll provide some general background, but before I get to that, I'd like to ask my fellow panelists to introduce themselves and let the audience know what their connection to ALS is. Jill, I'll start with you.
Thanks, Tim, and thank you for having us. I think this is so generous of you to listen to our stories and hopefully hone your art a little bit more. My name is Jill Bratton. My husband, Dave, a Vietnam veteran, was diagnosed in May of 2015 and passed in January of 2019. I started with I AM ALS shortly after that and have been part of that and other organizations to move this forward in both education and advocacy.
Thanks, Jill. Julie?
Hi, my name is Julie Suarez, and I have ALS. I was diagnosed October 19th, October 24th of 2019. So I'm involved with ALS. I am ALS because I wanted to see what we could do to make it better. Thank you.
Thank you. Our chat monitor tonight is Ashley Lee. Ashley, if you could introduce yourself and tell the audience your connection to ALS.
As Tim said, I'm Ashley, and my connection is my father. He was diagnosed in December of 2009. He's also a Vietnam veteran, and we're actually at the VA right now. So I appreciate all of your guys' time.
Okay, so Ashley's going to be monitoring the chats for anything that goes in there, whether it's from one of our panelists who will use the chat potentially, or fielding questions that the audience may have. There's no question that is off limits for our group. We're open and frank about everything. There have been times where someone isn't sure whether they should ask a question and they might just privately message Ashley with that question, and it'll get out there without attribution to anyone. Tim Lowry, for whom this panel series is named. Tim, can you introduce yourself?
I'm Tim Lowry from Buffalo, New York. I was a pharmacist for almost 30 years before ALS forced me into early retirement in 2020. I was diagnosed with ALS in October 2018. I enjoy doing these panels to raise awareness and help educate future healthcare students what it's like to live with ALS. Today, I am using my computer device as my voice along with chat to communicate. Thank you for allowing us to join you today.
Thanks, Tim. Deb.
Hi, everyone. I'm Deb Paust. I'm a community organizing associate with I AM ALS. And before that, I was the co-chair of their legislative affairs team. But before that, I was a physical therapy assistant. And I retired from that because my husband, Tim, got ALS in 2012. So I've been advocating for ALS for the last 11 years, and I'm really happy to be here, and I'm really happy that you're here to learn about ALS. Thanks.
Thanks, Deb. And Jake, if you could also introduce yourself, please.
So I'm Jake Paust. I lost my father to ALS when I was 20, and I became a physical therapist, and I specialize in working with folks living with ALS.
Thanks. And for those of you who haven't caught on, Jake is Deb's son. He comes at this from two perspectives, being the child of someone who was lost to the disease and then now is working with ALS patients, which is marvelous. I'm just going to briefly go through the PowerPoint to provide some basic education to everybody about what ALS is. It's commonly referred to as Lou Gehrig's disease because, as you probably know, Lou Gehrig is one of the most famous people who was diagnosed with this disease. It's also sometimes called motor neuron disease, or MND, which, as I understand it, is like in Europe is what it's commonly referred to. But ALS is a situation where the motor neurons gradually deteriorate and die, which means the brain can't get messages through the spinal cord down to the muscles to tell the muscles what to do. And so the muscles eventually, they slow down and then they eventually stop. They weaken over time, they twitch, they ultimately waste away, and eventually the brain loses its ability to start or control any voluntary muscle movement. And there are no known cures or treatments that reverses the disease. There's also no definitive test for the disease, and as a result, diagnosis can sometimes take anywhere from, say, 12 to 15 months because it's a diagnosis of exclusion. Doctors tend not to think ALS in the first instance, especially if the doctor who is dealing with the situation isn't a neurologist. And there are various tests such as EMGs, MRIs, nerve conduction tests to rule out other diseases and ultimately land on an ALS diagnosis. About 10% of cases are genetic, where familial ALS, where several members of the same family will get the disease. And that's why genetic testing also comes into play as part of the ALS picture. The early symptoms of the disease are muscle twitches in the arms, legs, shoulders, and tongue, muscle cramps, muscle weakness, slurred and nasal speech, difficulty chewing or swallowing, generation of excess saliva. This disease is unfortunately unique in that it affects almost everybody differently. There is no set pattern about how the disease starts or how the disease progresses. In general, if the symptoms begin in the arms or legs, it's referred to as limb onset. If the symptoms begin with speech or swallowing, it's called bulbar onset. So someone may not have the ability to speak or eat, but might be able to, for some period of time, have otherwise normal or seemingly normal muscle function. If it starts in the limbs, in general, it eventually spreads through the limbs and then upward to affect breathing. Most ALS patients ultimately die from respiratory failure. And the second point on this particular slide mirrors what I just said about how the progression varies greatly from person to person. We've got a timeline that shows the progression in its early stages, in its middle stages, and in its late stages, where unfortunately it paralyzes most of the muscles. limits, if not eliminates, mobility, makes it very difficult or impossible to speak. Some cases can't breathe without assistance. And as you see on the right side of the slide, 50% of people diagnosed with ALS will die within 3 years. 90% will die within 5 years. There's 10% that may well live 10 years or longer. One of the advocates that we work with at I AM ALS is, I believe, in her 19th year living with the disease after diagnosis. She is a remarkable lady, and she's not the norm for this disease. At diagnosis, my wife, for example, was told that the average time period is 2 to 5 years. And I think that's consistent with what most other people are told. If you look at some statistics, there's about 6,000 Americans that are diagnosed with the disease each year. And at any given time, 32,000 Americans who are living with ALS. And that may not seem like a lot, but it's because of the relatively short duration of time from diagnosis to death. Excuse me. What is the most telling statistic, I think, is that your lifetime risk is 1 in 300. So if you're in a graduating class of 1,200 people, 4 people in your class at one time in their life are going to learn that they have ALS. And it can strike at any age. Some of our fellow advocates were diagnosed in their 20s. Others aren't diagnosed until their 70s or even longer. Military veterans are twice as likely to be diagnosed with ALS as contrasted to the general public. The incident is up to, say, 5 or 6 times higher than the general public, with some of the more recent deployments into the Middle East. Jill mentioned her husband was a veteran. Ashley's father is a veteran. My wife was an Air Force veteran. So, we were all living with that aspect of this. Malnutrition is a problem in people with ALS because they burn calories faster because their muscles are trying to work to be able to communicate. And that's why there's a high calorie burn. So it's important for ALS patients to be nourished as much as possible initially through normal eating by mouth and then later with feeding tubes. You may be wondering, well, what causes this? Nobody knows. I mentioned genetics in about 10% of the cases, but there's also a lot of research going on for different potential causes, and nobody knows why it affects veterans at the increased rate that it does. Not much has changed since Lou Gehrig died in 1941. In 1995, a drug called riluzole, was introduced, and it at best will prolong survival by a few months. In 2017, edaravone was introduced. It also slows the clinical decline, but only by a few months. Most recently, a drug called Relyvrio was approved. It is horrendously expensive, not covered by all insurance, but is the most recent thing that's offering hope to ALS patients. But again, it's not a cure. It will just slow the progress of the disease. So we've got some slides that are specific to what you all are interested in from the physical therapy standpoint. Patients need a care plan. And everybody's different. Some aren't going to be helped by physical therapy interventions. Some will be helped. What you can do as physical therapists are prescribe exercises, help educate the caregivers on what techniques they should use with their loved one who has ALS to, stretch the muscles and do basic tasks like transferring them up to and from chairs and into the shower and so forth. Focus the exercises on slowing the progressive muscle weakening and preserving strength for as long as possible. Down the line, then you get into specialized equipment such as power wheelchairs. Hoyer lifts to assist with transfers and other things that you will see if you go into a clinical setting or the home of an ALS patient. So with that, we are ready to talk about this disease and answer any questions that you have. And I'm going to start by asking, so I won't ask all the panelists to comment on all the questions because we do have only an hour for this presentation. But one of the things I'd like to talk about is what were the first symptoms that you noticed, and were you thinking ALS during the diagnosis problem or something else? And Julie, I'll go to you, and then Tim, you next, because I'd like the audience to hear from the two of you who are living with this disease.
When I first started, in retrospect, I was falling. I had a lot of leg cramp, but I was a runner, so I didn't think anything of it. I'd take my pickle juice and cramps would go away, and I'd be happy. And so that continued, but then I went, I turned my ankle, so I was in a boot. And then when the boot came off, I was still limping, but it was my right leg. And I had a meniscus repair on that. So it's like, it's just, I depended on it too much. But then when I had to travel for work at the DFW airport, I ended up having to have a wheelchair person help me. And it was horrible. So when I got back, I started looking. It took me over a year. I thought my chiropractor was the first one to listen to me. He's limping, and he's like, "What's going wrong?" And then I thought, doing orthopedic surgery, surgeons, one neurosurgeon, one neurologist, a podiatrist, my physical therapy people. My physical therapists were trying to help me get doctor's appointments. And so I got no answer here in El Paso. Well, they told me I had Guillain-Barré syndrome. And I was like, yep, no, that's not it. So I went off to the Mayo Clinic. I got diagnosed there.
Thank you, Julie, for sharing that. Tim, would you share your diagnosis process?
At the beginning of my physical issues, ALS was the furthest thing from my mind. The first symptoms I experienced were decreased strength and dexterity in my right hand, wrist, and forearm. My thought was that it may be carpal tunnel. In fact, one doctor thought I needed surgery to fix it. After getting a second opinion at the neurologist, I was sent on a journey exploring different medical tests mentioned in the slides. About halfway through ruling out various diagnoses, I realized ALS was a strong possibility. Once the diagnosis was given, I knew my life would go in a radically different direction.
And let's see, Jill, can you share about how Dave's diagnosis process went?
Yeah, I'd be happy to. I think the diagnosis is a lot like the disease. Every story is unique and travels a different path. And some of us are very lucky to just get a break here and there, and that was our situation. Our daughter was a college basketball player, and Dave was her rebounding partner. And he came home one day and said, just can't shoot the three-pointers like I used to. My response as a typically good wife was, well, you're getting old. And he said, no, it's more than that. So we went to the doctor, and the doctor said, I think you probably have a pinched nerve. At the same time, our son was studying kinesiology in college and came home and listened to what we had been going through for the last couple months and said, I don't think it's a pinched nerve. I think you need to see a neurologist, and I have an idea of who you need to see. we were very fortunate to have him intervene and go to a neurologist. This poor neurologist was in his first 2 or 3 years of practice, and was kind enough to put us through all kinds of tests, the EMG, the nerve biopsy, all of it, and was in tears as much as us when he gave us a diagnosis. So you hate that. I hate it if you guys see this, but it is important to keep this on your radar, because sometimes what looks as many other things is actually ALS.
Thanks, Jill. I'm going to shift topics and ask Deb and Jake, because they come at this from the perspective of a spouse and a son. Can you talk about some of the challenges that you faced with your husband and father living with ALS?
Jake, you want to go first, or you want me to go first?
You can go first.
There's so many challenges and it's hard to pick one. I'm going to pick one that I think is relevant to you as physical therapists. So constipation was a big issue. The inactivity, and honestly, there's just, there's diet, and there's also mobility that helps with that. We had a few days where we were in the bathroom for 4 to 6 hours, not kidding. And so that's where range of motion, I would do modified yoga positioning with him, with deep breathing and some manual massage. And it's a common problem, and I think it's something that can be addressed, and it can, make the difference in the quality of life of someone living with ALS if they're not exerting all of their energy, in the bathroom. So that's the big challenge I'm going to share tonight.
And I think some of the biggest challenges, just as a son dealing with your father getting the diagnosis, it's a big shift. You go from your dad is taking care of you to you are taking care of your dad, and that's just kind of a mental challenge quite a bit. And so, one of the things was I was doing a lot of the transferring for him. And if he had to, go to the bathroom quickly, we had to move kind of quickly. And that was always tough. There were a couple times he fell on the ground and I had to get him up from that. That was challenging as well. So I think the biggest thing was just the shift in roles, though, of becoming a caregiver is a very tough shift.
And Julie, as someone who's living with this disease, can you share your perspective on your challenges?
Well, I agree with them. Unfortunately, that was a big problem, but I think we've got it figured out now. I've crossed my fingers. But the loss of independence, I was very independent. Met my husband and got married in 2013, and it was just coming. And so then, once we had the diagnosis, my challenge was when we were looking for a single level house, walking into the house, my legs came out with my ankles, and I broke my tibia and my fibula. And then I required 3 surgeries because the surgeons, quite frankly, checked up the first 2. And when I switched to an RV specialist, he did a great job and fixed that. But all of that time I was walking, I was doing everything, I could do things. And then suddenly I was in a wheelchair for 6 months because of surgery. So I think that loss of independence is horrible.
And Julie addressed the physical side of this, but Tim, I'd like you to talk a little bit about how important it is to live with, how important maintaining mental health is with this disease and how you do that.
Mental health is extremely important, as it is for all of us. In my adult life, I've worked on my mental health and spirituality. I continue to read. In fact, I read now more than ever. Readings that vary from Eastern and Western religions, philosophy, and stories of inspiring people. It has helped me have deeper and more meaningful relationships with family, friends, colleagues, and nature. So each day I start with my meditation and focus on what I'm grateful for. I have to let go of seeing and doing things as I used to. Some call it honoring the pain. Accept where I'm at, be honest with myself, then adapt and grow however I need to. This doesn't mean I stop fighting. It means I need to reframe, realign, and move forward. Being an advocate for I AM ALS and working on these panels with this great group of friends is a big boost. There are times I may ask a certain friend over who I think will lift my spirits. I'm also lucky enough to be married to a wonderful woman who I love spending time with. By no means do I assume I have all the answers, nor do I pretend that this is easy. I embrace each day and look for what ALS has to teach me about myself.
Thank you, Tim. And it's not just those living with ALS who have to take care of themselves like as Tim does. And so Jill and then Deb, I'd like you to address as caregivers what you did to maintain your equilibrium, if that was possible.
Yeah, that's a good question. I mean, just listening to Tim and Julie brings back memories. I think people diagnosed with ALS are just amazing, amazing people. Early on, Dave and I said we were going to live this with no regrets. And so whatever came to his mind or came to my mind to do or try, we did. As far as clinical trials or supplements, and also as far as vacations and getting together with people that we hadn't seen. Dave put together a group of friends that came over every week, and they went on all kinds of adventures together, and that was great for him, but it was good for me too, just to relax at home and take some time for myself.
Thanks, Jill. Deb, what about your thoughts?
Yeah, so I knew what I knew a little bit about ALS, and so I wound up getting counseling right away. The ALS clinic near my home offered counseling, so I took advantage of that. And for me, that was really important. I don't know how I would have done without the counseling. And then just taking care of myself. I was running and doing yoga and just trying to get myself as healthy as I could, because I knew I wouldn't be able to be doing those things. And so I guess I was just in preparation for the tough days ahead. The other thing I did was journal, and that was also really helpful. This is really a mind messing disease. It's mind messing, of course, to the individual that has it, and for all of us who love them watching, and this feeling of helplessness and this feeling of guilt. So taking care of my mental health was really important.
And I can certainly relate to what both Jill and Deb said. I do want to get into the physical therapy aspect of this, given the audience involvement in that. But I'm going to ask Julie and then Tim to first address what you would like people to understand about interacting with or working with someone who has ALS?
I think the most important thing is we're still have our brains. Our body might not be working, but we're still smart. We're still smart-eyed. We're still sarcastic. And don't pity us. Don't yell. We're not deaf. I'm trying to think. There's a lot of things that I think friends are afraid of seeing their decline, and they say, "Oh, I just want to remember you like you are." And I have called BS on a couple people and said, "No, you know what? If you don't come see me when I'm alive, do not show up at my funeral because you will not be allowed in." And I'm serious, so because I plan on having a party when I know the end is near. So if you haven't been involved, you're not getting an invite. Yeah, there's no services after that. So
Thanks, Julie. You're one tough lady. Tim, what would you like people to know about
Want
interaction?
people to understand that I'm still here inside this body, even if I have trouble talking or moving about. Don't take pity on me, because I don't. Interact with me like you do others. It just might take me longer. I want people to just be a little more patient than normal when I'm typing with my eyes, as I think hearing what I have to say can be fun and possibly worthwhile.
Okay, Deb, I see your hand up.
Yeah, if I can just tag on that a little bit, just kind of from a clinician standpoint, is that, you know, people living with ALS, they're losing so much of their control, and they want to remain with their dignity intact. And Tim was absolutely right about having patience. They're going to be moving slower, and no matter how busy your schedule is, you gotta focus and give them the dignity of not rushing and let them take their time. The other thing I want to say is that it's so important for people to be able to say what they need to say. And healthy people have this tendency of plugging in words as somebody is kind of getting another breath. And it takes so much energy, but it's so important that they are heard. And so I just want to caution that don't fill in the words for them. Let them, they're trying so hard to say what they need to say, and there's that satisfaction to that. So I know the PT departments are super busy, but those are the things that I can remember Tim saying, boy, people just don't have the patience to let me finish, and it's frustrating. And one more thing I want to share is that Tim didn't like being in his wheelchair and people standing up and looking down, talking to him. And so I would just pull chairs up next to him so people could get the hint or just sit down. But, you know, try to get eye level. That makes everybody feel a little bit better when they're conversing.
Thanks. And Jake, I was going to ask you the same question from the clinician standpoint.
Yeah, I think the biggest thing is that you are still communicating with the person living with ALS, and getting to their level and talking to them is key. Don't just talk to the caregiver, because that, you know, can be a little disrespectful. The next thing too is, you know, if you're seeing that person consistently and you have a good relationship with them, it's okay to make jokes about things. It's dark humor. It's one of the things that people in this situation appreciate because it makes them feel normal again. We all make fun of our friends for little dumb things. It's okay if you have the right relationship with someone living with ALS. It makes everyone, you know, it makes a bad situation a little bit easier. And so it's okay to have a little bit of a personality when you're working with people with ALS.
I see Tim nodding in agreement. You're, I know, an aficionado of dark humor. So, Jill, I know Dave had physical therapy, so I'm sure you met as well with the physical therapist. Can you tell the audience what it was like when you had those meetings, and then whether you have any kind of a favorite story or advice you can share about how the physical therapist best helped you and Dave?
Yeah, I'm gonna kind of tag on to one thing we were talking about too. The disease of ALS is a disease of anticipatory grief. You're losing something all the time. So to be able to go to another setting, and we were very blessed because our physical therapist actually was a close friend. So we would go at 11 and we would spend an hour in physical therapy, and then we'd all go to lunch together. And it was great. It was time to get away from the disease for a little while, spend some time with a friend, and also solve some issues. Dave started in his hands and his arms, so he quickly lost use of his arms. One thing that happened with him, he was still walking, still getting around, but because he did not have use of his arms, they pulled on his shoulders so badly that he was in immense pain for that. Andrew, our physical therapist, was wonderful about saying, I'm going to tackle this problem and I'm going to find a way, whether I have to make my own brace, whether I have to devise something for you to wear, which ultimately is what he did. I'm going to help. And it meant so much to us to have him on our team and have him taking care of an issue that we didn't even know how to begin to take care of. He was patient, and he helped me learn a lot of exercises to help with that spasticity that Dave went through. And just having him on, like I said, on the team makes a huge difference. You don't feel so much all alone.
Thanks, Jill. Julie, what about you? Have you met with a physical therapist, and can you talk about that experience?
So my physical therapist rehab me through an ankle break, a shoulder break, and my knees, my meniscus repair. So we had an established relationship, and we would joke all the time. But she and my massage therapist worked hand in hand to help me. But my massage therapist died of cancer. But let me tell you, when she was over at the house, because she was on oxygen, because she told Alexa one time, Alexa, play stripper music. And we died. The songs that came on were hilarious. And we had to stop laughing, but it was great. So I'm very happy with my initial PT people. They actually took ALS courses for CEUs. But my first home healthcare PT she had no clue what ALS was. She would not listen when and I tell her, I know you're the expert, but I've been working with the physical therapist. Here are the things we did, and she just never listened. She kept telling me, well, you need to recover your strength. So I was like, that's not what you do with ALS. And so her final notes indicated that the patient was not regaining her ability and mobility. So she recommended discontinuing PT. And I switched. And now I have my husband says, good riddance. But I now have a great physical therapist. And we work as a team. And I have an occupational therapist. So we all three work together. And I love them.
Okay, thank you. Ashley, you're not getting much work as chat monitor, so do you have some physical therapy experiences you can share with the group?
Kind of along what the lines of what Julie was just saying, the biggest thing I can say is how important your approach is. Not getting the traditional rehabilitation, getting you back to regaining loss mindset. My father was diagnosed at one VA, and the only appointment he ever went to on his own happened to be a occupational and physical therapy appointment. And the therapist literally gave him a sheet with exercises on it and said, I have no idea what the point of this is because you're going to die anyways, but here you go. And he came home from that appointment and was like, do not tell me to go anywhere anymore. Like, and I was like, what do you mean? And he told me what happened, and he was like, I'm not going anymore. We very soon after that switched to a different VA that actually had ALS center, completely different approach. And I had to pretty much beg him to give it one more try, because he was like, why do I want to do that again? I don't want to go through that again. And it was a night and day experience, and he enjoyed. It was almost one of the only things that he would do away from me and say, you can go and do without me, because he genuinely enjoyed, whether it was inpatient, going to the gym and using the things they have here, or whether it was when he was outpatient and visiting with them. He really, truly enjoyed his time with the occupational and physical therapists, and even kinesiotherapists that we have here also, because there just wasn't any of that mindset that because it's ALS, there's no reason for you to be here. And so just remembering that just because somebody is living with a disease that is killing them doesn't mean they don't want to live.
Thanks for sharing that, Ashley. Deb and Jake, from the standpoint of clinicians, what hands-on advice, no pun intended, can you give the students here?
I would say education is absolutely key. You're going to be educating the caregivers on how to do this. A lot of the times, if you're going into the home, that's going to be the highlight of their week, is to have someone stretch them, help with their mechanics, work on their breathing mechanics and positioning. That's the highlight of their week. And it's very important to teach that to the caregiver, especially early on. As you kind of get there more consistently, then you kind of transition into telling the caregiver, hey, I will let you know at the end of the session what you need to know. Take this hour for yourself. Let me just give you a break. Let me work with the patient or whoever it is. And that way, they get a break. It's an hour off. You're working with the patient, and it's just a nice way to go about it. And I always recommend too that to have different parts of the support system there so I can teach multiple people how to stretch them. That way they're getting stretched more consistently.
Thanks. Deb, what would you like to add to that?
I'm thinking about the benefits of the stretching and the benefits of having family and caregivers do it. It didn't feel like a chore. It was, and I think the way you present it, people living with ALS don't like to ask more of their caregivers because they sometimes feel like they ask too much already. And doing things like range of motion for our family was just quality time with Tim. And you can kind of turn it around so it doesn't feel like it's a chore. You can present it as something other than exercise, because it really was a special time for us. And I know that my husband was, we did it 2 to 3 times a day, every day. He was so comfortable and so flexible, and he looked so good that, there wasn't pain in his face, and the quality of life, and just by promoting it's range of motion, and it seems so simple and basic, but it's really one of the best things you can do for someone with ALS, because the quality of life is so important. And yeah, that's, I think, all I want to add to what Jake said.
Jill and I are in the same boat, in the sense that we were caregivers and our spouses had roughly the same diagnosis time and passing year. But when I listened to this, I remembered that one of the things that I did for my wife first thing every morning before we got her out of bed was range of motion exercises. But she would always say that I was too rough. And so one of our better home care aides actually said to me, she said, lie on the bed and I'm going to do to you what you do to your wife so that you know what, she is experiencing, which, was actually about as practical advice as you can give a guy like me. Julie, we'll go to you, and then Ashley, I think a question I just saw in the chat, but Julie, you had your hand raised.
So I still have a relationship with my first physical therapist. My husband still works, so I have caretakers come in every day. And a few times if I need help, she comes back and she gets up at noon on Fridays. She'll come over, we'll have lunch, sometimes a margarita, and then she teaches my caregivers how to do my stretches that are necessary at that time. And the other thing is I've always been super, super flexible. So Preserva knows when we're putting my knee up, you have to touch my shoulder so I'm not getting stretched. So, people are like, oh, we can't push you that far. She's like, if you don't, she's not getting anything out of it. So I think that, there's PCs are wonderful.
Thanks, Julie. So Ashley, there's some chat activity, I think, right?
Yes. So Zane asked this question mainly to Jake and Deb. How did you manage conversations with patients and families who are adapting to their new normal?
I'll make it quick, Jake, and then you can follow me. But I think you really have to be a good listener and really pay attention to everybody's at a different place of acceptance with their disease. And I'm always mindful not to give them too much of the picture down the road. You don't want to overwhelm them. You don't want to be talking, if they're newly diagnosed, you don't want to be talking about the wheelchair because it takes, months before they can get it. I mean, that is true, but you have to really get to know the patient and try not to advance. And that's really tricky because everybody advances in this disease at different times, but you can over-educate, over-inform, and then you're not going to see them again. So it's worth the time. And I know we're in physical therapy, you're trying to be proficient and get all the productivity and all of those things, but the best thing to do is to try to listen and know them and know how to best guide them through it. Jake.
Yeah, and I would agree with that. It's about making sure you're communicating clearly and the information that you're providing needs to be correct, but not overwhelming either. Some people are just in shock about what's going on, and you need to be able to identify, okay, they're listening, but they're not understanding, and knowing when to stop there. And once you have that relationship with them, there are a lot of difficult conversations that you will have to have. And people don't want to hear some of those recommendations that they need a walker or a wheelchair, or it's time to start considering that stuff. But when you are working with this patient population and they start trusting you, sometimes you're the one that has to be like, okay, we need to make sure you have a walker moving forward. And it's difficult, but it's you manage.
One other thing I know, Jill, I'm going to make this really quick here. I know you got your hand up, but to be like a calming guidance to them. They're in their head and it's too much. It's just overwhelming, but to be calm and reassuring, let them know you're going to be fine. I'm going to help you through this.
Jill, so you have your hand up.
Yeah, I just wanted to add a couple things, and Deb, you said it well too. You have a million things coming at you when you have ALS. You're looking for clinical trials, you're talking to your neurologist, you're trying to find all kinds of things, and you're trying to stay a step ahead of this disease that will change on a dime. So to be able to come to a place where someone listens and doesn't correct you. So I have just one story. Dave always wanted to measure his grip strength, and Andrew would measure that grip strength even to the day where it came that Dave couldn't even hold the tool to measure the grip strength. He still would do it because Dave wanted to do it. What harm does it cause? And it meant everything to Dave that he still had some control over something, and he wanted to measure that grip strength. So just, it doesn't hurt to just follow their lead sometimes and say, yeah, if that's what you want to do today, we can do that, and we'll do some other things too.
So we have a question in the question and answer, and then I'll get to the questions in the chat. Someone said, my boyfriend's father was recently diagnosed with ALS, December 2022. I just wanted any advice on offering support and help to my boyfriend and his family, because it's so new to him and his dad and his family. I never want to feel like I'm overstepping. As a first-year PT student and also living 600 plus miles away from them, I just want to know what I can do now or in the future to be there for them in this journey.
Others may have different perspectives, but I think you've got a great opportunity here to not look like you're overstepping and be able to say, hey, I was on this panel, or a member of the audience at this panel that this organization called I AM ALS put on. Here's their website, which is iamals.org. They have a lot of resources there, a lot of information. They have, support people, and you might find this useful. Deb, Jill, what do you think?
I think I think that's great. I AM ALS does provide an awful lot of services. I also think it's important to stay connected. One of the things, even though you're far away, we're lucky with technology, and to FaceTime and stay as personal interaction as you can from a distance. I know with my husband, we had friends that said, hey, we want to be with you, and do this. And I told them, if you're going to do this with us, you need to be here like every 2 weeks, because if you go longer than 2 weeks, he was a fast progressor, so he was declining. And I thought he would be very mindful of his changes, and it would be uncomfortable having somebody he hadn't seen in a while pop in. And so just if you want to be part of this, then I think you be part of it from right now, and give a friendly FaceTime call every week and build that relationship. So when you are there, it's comfortable for your boyfriend's dad.
Yeah, I'd agree with that. And I'd also just second the jumping into I AM ALS. There's so much support there, not only from the staff, but also from people like us that are on Ask Me Anythings, which is a thing we do every month with different subjects. There is a whole support team that you can ask all kinds of questions to, and we can lead you to other places too. So when you get this diagnosis, a million things run through your mind, and you have a million questions, and you can go and search for those answers on your own, but time is always of the essence. So if you can go one place and they can direct you to the help that you need, that makes a huge difference.
I wish that I AM ALS existed when I was going through what we were going through, and I know Jill feels the same way. Deb? Oh.
I was just agreeing. I wish they existed when Tim had ALS as well.
Okay, so I'm not. If any of the audience has questions, please.
We do have one more question. Somebody asked.
Okay, thanks, Ashley.
What resources do you recommend we connect our patients to outside of physical therapy?
Jake or Deb, do you want to field that?
Well, besides I AM ALS, I'm trying to think.
I would definitely say look at your local LEN closet from your local ALS chapter, just because that way you can get certain medical equipment that they kind of rotate through relatively quickly. And that way you get the resources you need right away and you know where that is. Speech therapy, occupational therapy are obviously good things to always do as well. Massage therapists, if they can come into the home to help out with that, that's another good resource. One thing I would recommend that we did was we organized a meal train, and that took a huge thing off our plate. And all we would have to do is, every week someone would come by, drop off some food. If it was a bad day, we would leave a cooler out in the front. Everyone kind of knew, hey, we just put the cooler or put the food in the cooler. They're just not up for visitors. And that was a nice way for people to still help out with us, but also respect that, hey, there's just some days that are bad days.
Thanks, Jake. And then Ashley, I see you want to add something.
I just wanted to second kind of what Jake said, the emphasis on recommending not just speech therapy, but voice banking early on, because of not knowing progression and having no idea what, how fast it's going to be. You may not need it for years, but the sooner you do it, the more you have your actual real voice that sounds like you. And not only does it make it easier for you later on to use a computer like Tim is, but your family will have that. And it ends up being something that they can cherish forever, that they have your voice to keep. So just, that's a really, really important thing that you can recommend as early on as you first, get to know them.
Thanks, Ashley. So we're coming up on the bottom of the hour. So I want to give the last word to the guy after whom these panels are named. Tim, what is the best advice that you want to leave this audience with?
I would like to wish you well and hope you enjoy your career. I hope you practice your profession with empathy. Your knowledge is easy to recall, and remember to take care of your own physical and mental health as you strive to give the best care possible. Thank you for allowing us to spend this hour with you.
Thanks, Tim. Are there any other quick comments any panelist wants to make, or any remaining questions from the audience? Kate, I see your hand up.
Yeah, I just wanted to thank all of you for getting on this tonight. I'm really, really interested in working with individuals with neurological diagnoses in the future. And, they do, our schooling, our institutions, they do their best to kind of give us a generalist level of knowledge. But I do feel that ALS is one of the areas where there's just so little information, and it tends to kind of get like skimmed over. Like they still teach us about it, but not nearly in as much depth as other diagnoses. So I really just wanted to say that I truly value all of the information you guys have shared tonight. It's definitely been, I think, eye-opening and also very, I don't know if humbling is the right word, but to be able to be someone who's going to be in the position to help care for individuals like your loved ones and Julie and Tim. So I really just wanted to thank you guys for coming on tonight and sharing everything that you did.
Thanks, Kate. Deb, I see your hand up.
Yeah, I just wanted to say that, I know you as students, and when you get into your jobs, you'll be giving in services. And I AM ALS has got great resources. You've gotten some great information, and one of the best things you can do is advocate. You're going to have to give those in services. So we've just given you this great information that you can take to your clinicals and to your new jobs, and you can help spread the knowledge that you've gotten tonight. So thank you and good luck to all of you.
And Terrell,
Oh,
Terrell,
sorry.
thank you for setting this up. Julie, I'm sorry to interrupt you. I just wanted to thank Terrell. He was my contact person and I'm finally seeing him face to face. And then Julie, you had a comment you wanted to share.
Okay, I already lost it in my face. Okay, it's gone. Thank you.
Hey, this is Julie's husband. I'll tell you something here. The word is care. And we've had professionals that we've dealt with that didn't have the right level of care, even though they had the credentials. We talked about a doctor and we talked about somebody else. But there are other people that we've dealt with that had the same credentials, but had a much higher give a crap, if you will. And the difference is amazing.
Jake, I see your hand up.
Yeah, so just kind of parting words since for PT. One of the main things, especially just know your practice act very well in the state that you practice and know the telehealth laws and regulations that you guys have. You can help a lot of people that way. Every practice act is different and the language is ambiguous sometimes on purpose, especially with direct access, and you will be able to help any patient population you care about. Being aware of these things has allowed me to help even more people with ALS, and that's just the niche that I care about because it obviously has a special place in my heart. So know the ins and outs of the legal aspect of your license. It can help a lot of people.
Thanks, Jake. Julie, I see your hand up.
Because I remember. So what I would recommend to the students is follow I AM ALS on Twitter. When you create a LinkedIn, follow them on LinkedIn, follow them on Facebook and Instagram, and there are very young people get diagnosed with ALS. And oh my God, they're handling the education process like pros. So you will relate to a lot of the things that they're saying.